Okay, this is going to be my like 3-month nursing update. I'll basically just kind of summarize the first 3 months of nursing. Basically, when I was in the hospital, I thought I was not making enough milk because my child was just screaming all night long, just screaming. And then the nurse looked at me and I guess she thought I was crazy. But basically the reason why he was screaming was because his belly was just so filled with gas. He had jaundice really bad and his intestines weren't working like properly. So he was just extremely gassy and it made it so difficult. So I don't know if they do this in the States, but here in Germany, they will give the baby sugar water to kind of quench the baby's thirst. So they would give that to him because I always thought that he was hungry. And finally the midwife was like, no, he's just really gassy. And so she gave me these gas drops to give him before feedings to try and just help him get the gas out. He was a really, really hard baby to burp. Like, I had to kind of try and find some special technique just to burp him. He was seriously hard to burp. I was like, oh my gosh, he doesn't burp. But it wasn't that he didn't burp. It was just that I didn't know how to burp him properly. But finally, we kind of were able to work it out. But yeah, after the first day of, the first full day and night, I just wanted to give him formula. I was like, please, just ask one of the nurses, please just give me the formula. Just give me the formula. And then the midwife came in and she was like, what do you mean you want formula? And I was like, he's hungry. He's not, he's not getting enough. And this was before I knew that it was gas. And she just told me no. She was like, if you want to breastfeed, you're going to have to keep putting him to the breast. And I was so mad at her for telling me no. I was like, there are a million other people in this hospital and they're giving their babies formula. Why can't I do it? But she knew how important breastfeeding was to me. And she refused to just let me give up at that time. And I was really, really grateful that she did that because I pushed through it and I was really concerned that I wasn't making enough milk. So after every feeding, I would go ahead and I would pump. But while he was in the hospital, they had you weigh him before every feeding and then you weighed him again after every feeding. And they gave me, they told me how many grams he should, how many more grams he should weigh after every feeding. And sometimes it would take a good hour to get him the amount that he needed because he was such a lazy nurser. He was so tired. The jaundice just had him just so exhausted. It was so difficult for him to nurse. And for me to get a proper latch, my boobs were they were very large and his mouth was so small. And I had to, hold my boob and I had to squeeze my breast and kind of it almost seemed like I had to just kind of smush my nipple to get it in there and to shove it in there far enough for him because it was just all too big for him. But at least somehow, it took an hour, but somehow he was gaining the weight that he was supposed to. And then after every feeding, I would go back into my room and I would just pump. Or if there was still any milk, I would just pump all the milk out that I could until my boobs, just no more milk was coming out. And then I think probably the second day I was in the hospital, they told me that I was making too much milk so that I should just probably stop pumping or decrease the amount of times that I was pumping. But I was like, that's not really a problem for me. Too much milk is not a problem. Not enough milk is a problem. But basically they were right. I think for the first month I was pumping in addition to nursing, probably 6 times a day. And I basically filled up my freezer with large bags of breast milk. And now I don't have any more space for any more milk. So then I ended up pumping and I'd ended up having to throw out my milk. I know that's awful because there are a lot of women that could use breast milk, but I don't really know exactly how to donate breast milk here in Germany, because I know that you have to get all the testing done and such, and then you find someone, and then you have to be able to give them that milk within a short amount of time, or, do the dry ice. So yeah, it's kind of a big hassle. And because of my heart condition, I do take daily medications for it. None of them pass through breast milk, but some people might just be uneasy with that. So I don't know. So I never proceeded to try and donate breast milk, but I don't know. Maybe one day I'll do that. So basically I was just pumping, and I would end up just dumping it, but my son, he could get full really fast. I know a lot of people, they say that they're child nurses, for 15 to 20 minutes. He would nurse for maybe 3 minutes, and he was full, and not a little full, he was full. And he was gaining weight so quickly that the doctor said that if that's all it took, my boobs, they were squirting everywhere. It was like a big sprinkler. So he was getting an adequate supply of milk in a very short amount of time. So I was really concerned about that, though, because he wasn't nursing for very long. But they said because of the amount of weight that he was gaining, that it wasn't a concern. Just as long as he's gaining weight, they think that I might be feeding him maybe a little bit more than what he needs, but I'm okay with that too. A little chunky baby, that I'm perfectly fine with that. So now I might pump once a day, sometimes twice a day. It just depends on how often he's nursing and how my breasts feel, if I feel like I need to pump or not. I was able to get a hospital grade pump from our post here, and I also have the Freestyle Medela breast pump for if I'm traveling, so that always came in handy. But after I left the hospital, I went ahead and I just saw a lactation consultant, because we have one on post, and I just had her, look at my technique, and she was really surprised because normally she tells people, not to squeeze their breast or manipulate the boob in any way at all. But she looked at my boobs and she looked at my little baby, and she's like, yeah, you kind of almost have to do that in order for him to eat. So she realized that there was no way that he was going to get fed unless I did that. So it doesn't hurt when I nurse, and my nipples, they don't bleed, they're not red, they're not irritated at all. So she's like, okay, well, if it's working for you, then just keep doing what works for you. So that's what I've been doing. And I just nurse when he's hungry. It doesn't really matter where it's at. If he's hungry, I'll nurse him. I do use a cover, although it is a very big hassle. He gets really distracted because it seems like the cover is just too dark, maybe. I'm not quite sure. So he does a lot of just the head wiggling around, trying to find the boob. So he gets really frustrated, really quickly with the cover. So I'd prefer, obviously, not to nurse with the cover, but a lot of the people here, it's just a preference for them, for breastfeeding. They don't mind breastfeeding, but they just prefer that I do it with the cover. So I'm trying to be respectful of their wishes, and as long as my child's getting fed, that's my main concern. So but if it ever becomes a problem, then I will seriously, a real problem, then I'll probably just ditch the cover altogether. But other than that, he is finally now able to make it maybe a 6-hour stretch at night. But other than that, I think he's nursing probably every 3 hours. I think maybe less time than that. It just really depends. It's kind of just a day-to-day difference. There's not really a set schedule, and I don't really, I mean, I'm fine with it the way it is. I'm able to stay at home with my boys, so it's not really a problem. And I haven't had to break out the bottles yet, and I haven't had to go into a freezer stash, so I'm really happy with the way nursing is going so far from me. My older son, he was never able to latch to my breast, so this is like my first experience with like actually having a baby that latches. I had to exclusively pump for him for 15 months, and then at that time I was like 20 weeks pregnant. I don't know if like my hormone levels just shot up or what, but he no longer liked the taste of breast milk at that point, so he just stopped taking my milk. And when we came home, I offered him some in a cup and he threw it up, so I haven't done it again since. I felt really bad that he threw up. So the only thing is that my older son, he seems really interested in me nursing because I'm giving, you know, the baby one-on-one time, and I think he's a little bit jealous of that, even though he never had that time. So I do see that he comes to my breast, but he doesn't really understand or know what to do, and he doesn't understand what the baby's doing. But it's almost like he tries to mimic the baby, but I just like, yes, okay, yes, this is mommy's boobies, and it's for the milk for the baby. So we just try and explain to him, you know, that it's so mommy can feed the baby, and but he still has an interest. But I obviously don't want him to feel bad for having an interest, and I think he's just trying to get attention, so I don't see a problem with it. I just need, I guess, like a bigger lap so I can nurse one and just hold the other one so that we don't have a problem. But so far, you know, everything's going well, and my son is growing like crazy. So I'm gonna have to do some videos of the boys when they're actually awake. So, okay, sorry, I'll stop now, but thanks for watching. All right, bye.